can I put it like, pathologists save, more lives? What is the difference between a lab technician and a pathologist? It's kind of a pressurizing thing for any patient who walks into the lab, right?
Absolutely. So you go to a doctor only when you have some symptoms, right? Or
So what is the difference between a radiologist and a pathologist?
right. Again, a wonderful question. We both are diagnosticians. The only difference is that
How is it seen when we speak that form?
Behind every diagnostics, every treatment plan, and every life-saving decision, there is a silent hero in every lab. Today, we are going to talk to that silent hero, a pathologist, Dr. Supriya Tiwari, who turns a lot of cells into stories. Welcome to an episode in Go Make a Difference.
thank you so much, Ishwarya.
Thank you so much for taking your time and coming here. It really means a lot.
It's my pleasure to be here. Thank you so much for having me.
Our pleasure too. So Supriya, can you please first tell us who is a pathologist?
So you gave a very wonderful introduction, but pathologists are specialist doctors who diagnose every diseases known to mankind from head to toe. So after MBBS, we tend to do our MD in the subject, and yeah, we diagnose our patients.
Okay. So every pathologist also does an MBBS, right?
Yeah, so we do MBBS and then we do our MD.
Okay. So MD specialization in pathology.
Pathology, yes.
Okay, got it. What actually interested you to do pathology?
So I have always been interested in diagnostics. In fact, since the time I was a medical student, it always intrigued me to get to the bottom of, why someone is having these symptoms or why they are suffering. But I worked in respiratory medicine, where we had the first interaction with a pathologist, and I saw firsthand what a right diagnosis can do to patient, and that really inspired me to learn more about this field, and that's how I got interested.
Oh, that's amazing, amazing. So, in fact, can I put it like, pathologists save more life than the doctors at the
Absolutely,
first?
absolutely. I would agree to that. Even though we don't meet our patients, we are always advocating for them from behind the microscope.
Right. That's amazing, right? So, cells into stories is something that definitely all the pathologists do.
Yes.
So, when we say pathology, right, it's a very broad terminology and it's a big jargon.
Right.
What is the difference between a lab technician and a pathologist?
So, lab technicians are very important part of the team of diagnostics, but they are mainly concerned with, learning how to operate the machines and processing of the samples and those kind of things. They are not necessarily involved in looking the slide under the microscope and, learning about the different patterns and then correlating it with the clinical context and giving a diagnosis. So that part comes to a pathologist.
Imagine I walk into the lab, right? So can you just walk us through the entire process? Because it's always something, it's kind of a pressurizing thing for any patient who walks into the lab, right?
Absolutely.
Even if it's going to be a very basic test. So what actually happens inside after we give our samples for any test?
That's a wonderful question, and I'm sure a lot of people might be wondering about it. So there are 5 basic steps. It starts from receiving of the sample, obviously, and then we have there is something called as identification. So we provide a unique ID to each sample, so that there is there's no confusion or error of sample belongs to whom. So identification is very important, and we do the barcoding and give a unique identity number, and then the sample goes into processing. So that differs depending on what type of sample it is. So if it is a tissue biopsy sample, then that will be processed differently. If it is a blood sample, that will be processed differently. If it is a fluid sample, then that will be processed differently. And once the sample is processed, it ends up under my microscope, and then we go through it, we diagnose our patients. And the last step is to dispatch the report.
Okay. So when you say these 5 basic
Steps,
This is
yeah.
the steps, right?
Yeah, yeah.
So when you get, for example, blood test, that is something
Yeah.
very, very common.
Very common,
And
yes.
it's very good that many people have that awareness these days to give,
Yeah,
probably
yeah.
yearly once or some,
Yeah.
test that has to be done. So how often do you recommend somebody to get a blood sample check to be done?
So ideally, if you're above 30, I recommend getting a yearly test done, because I feel like nowadays we are getting all the lifestyles disorders much earlier than previous generation of people. So once a year is fine. If something turns out to be abnormal, then you have to repeat it in another 3 months. Depending on whether you have been started on treatment or not. So anywhere between 3 to 6 months,
Okay.
if anything is abnormal. Otherwise, yearly once is
Is good
absolutely
enough.
fine. Yeah.
Okay. So now that you've told the 5-step process, how important is a pathologist role, and where do you actually intervene in the entire process?
Right. Like I told you, it depends from sample to sample. If we are talking about a biopsy sample, let's say a person develops a small mass and he visits a doctor's. So, depending on the first investigation that they do, let's say if a biopsy needs to be done or if IFNAC needs to be done, then a pathologist would come into a picture. We'll do the procedure, we'll take the sample out, and then the identification and everything is done. And then these samples are then fixed because we want them to stop deteriorating. So we put them in a preservative and keep them for 24 to 48 hours. And after that, they're embedded in the wax and cut into thin paper slices to be put in the glass slide. And that glass slide I see under the microscope. So the processing part is taken care by the lab technician. Doing of the procedure, reporting of the sample depends upon the pathologist. And I think a lot of people, what they don't know about our role is that it's extremely important to give their disease a name, and because that decides the treatment. Right? So I am the one that tells their doctor what exactly is the diagnosis and what kind of treatment will probably work for them. So if it turns out to be cancer, I have to not only grade it, I have to tell them about the stage, I have to tell them about what type of cancer it is, and then based on that report, a doctor has to decide whether chemotherapy will work, whether radiotherapy will work, whether it should be a combined approach or some other targeted therapy. So I think there's a very important role of pathology that a lot of people don't realize.
So the starting for any life-saving disease is also from a pathologist only, isn't it?
Yes. So even if it is a non-cancer situation, for example, an infection, because modern medicine is heavily relied on evidence-based, right? So that evidence is provided by pathologists.
Okay.
Otherwise, no treatment can begin.
So you have told only modern medicine, right? But the reports can actually be taken even to Ayurveda or any other form of medicine, right?
Absolutely.
So,
Even in that case, it gives a lot of data point,
Correct.
right, to
Right.
understand patient's health or what their body is trying to communicate. Those are all things that are taught by a pathologist. So it doesn't matter which branch of medicine that you rely on to get better. I think pathology still plays a very important role.
Absolutely. So moving on, what is one thing that you really wish that the general public actually knew about pathologists?
That's a very good question. And one thing that I really wish people knew is, so you go to a doctor only when you have some symptoms, right? Or now I have to give it to current population, they are very aware of things, but people think that pathology is only about shocking discoveries or when you are sick, whereas it is also about staying well. Like I told, it gives us a lot of data point. If you wish to live a long life, you have to know what your body is trying to communicate, and those information can empower you about your own health. So pathology is also about staying well. It's not just about when you are sick. Yeah, so that's one thing that I really want people to know.
That's really nice. I mean, it's another way of looking at things, isn't it? And staying fit and staying well has become probably, majority of the people, they started realizing that it's very
Yes,
important.
yes.
So that shift in mindset is also very interesting.
Yeah.
What is the difference between a radiologist and a pathologist?
Right. Again, a wonderful question. We both are diagnosticians. The only difference is that they use imaging techniques to come up with a diagnosis.
Okay.
Whereas we actually see the tissue, we actually see the sample for what it is. So a pathology report is usually considered gold standard because we are actually seeing the tissue. Whereas radiology, of course, they have a huge role, and they help us a lot in getting to the accurate diagnosis. But it is using imaging techniques and not directly seeing the tissue.
Okay. So
Yeah,
that's the only
difference.
Uh,
But they also deal with everything from head to toe.
Head to
and
toe,
so there is a lot
yeah.
of studying in both the branches.
Okay. So radiations will not affect a pathologist, right? Because you're not there in front of the...
No. Sometimes when, let's say, a lump or something that is inaccessible, we're not able to reach that to do any procedure. In that case, we will require the expertise of a radiologist to guide us. And so we do a lot of guided FNACs, which is a fine needle aspiration cytology. We just put in a needle to any of the swelling, but where that swelling is, that is guided by the radiologist.
Okay.
So it's a very integrated branch also. We work together a lot. Yeah.
That's amazing. So you will be receiving samples day in and day out, right? So there will be a lot of infectious samples also.
Yes.
How do you actually handle that? Because it's not safe for you as well, no?
Yeah, so we all follow the universal protection protocol, especially dealing with the infections, the mask, the gloves, all of these things are very important. And I think because our lab technicians are the first ones to come in contact with those samples, it is also equally important that we keep them educated about these things.
Right.
So, yeah.
So how was the scene when we peaked at COVID?
Oh, it was definitely very difficult because you know how a lot of cases were undiagnosed during COVID, right? And we were getting a lot of blood samples and a lot of deliveries were happening. So we were getting placenta samples as well. And we were the first ones to kind of, and with the microscope, we are so close to the sample actually. I am like literally putting my eye. So there was a huge risk and none of us knew what has to be done. So we were just relying on the universal protocol and thankfully we all came out of it stronger.
That's amazing. I mean, that's because like we say, the nurses, the doctors, they were all there in the front, right? So
Yes,
there is a huge role played by every pathologist because I think there were huge queues in every diagnostic center for giving the samples also, right?
And I'll have to point out that all the lab professionals, there's also microbiologists, there's also biochemists, and all of them were equally involved in fighting the COVID, even though none of us, met with our patients, but we were dealing with their sample very closely.
Right. How different is a microbiologist or a biochemist and a pathologist?
So there is a lot of overlap in the different kind of tests we do, definitely. But a microbiologist is essentially someone who deals with infectious diseases. They are the ones who are culturing your samples in the laboratory to tell, which bacteria or, which virus. And they can also tell you whether the antibiotic that you're on is working or not. So they deal with those kind of things. Whereas a biochemist usually deals with all the biochemical tests, for example, your sugar test or, your LFTs, liver function tests. So those are the things that are dealt by a biochemist.
Artificial intelligence is actually taking over everything, right?
Yeah.
So that threat, or I don't know, advantage or disadvantage, that you should actually tell us. So is it a bane or a boon for pathologists and tests?
So there's no denying it, right? Like it is coming. We cannot run away from it. And I am, for one thing, a person who believes it can be a powerful tool because it can definitely help us do our jobs better. There's a lot that's happening on the AI front in terms of, training the models to kind of pick up some atypical cells or tell us about the highly suspicious area within the slide. Things that a human eye can miss, AI can pick it up. So I really feel it will help us do our jobs more efficiently and more accurately, but as a powerful tool, not as a replacement. I mean, not at least now, never say never, but not in next couple of decades.
Okay. So long way to go there.
Yes.
Okay, fine. Can you actually share an example where the current AI has actually made any difference in your diagnosis in any of the tests?
Right. So AI has not been adapted by a lot of labs in India. It is still coming up. But I am aware of the models that has successfully picked up some atypical cells in prostate cancer or in breast cancer, even pap smears. So it's definitely emerging as a powerful tool, how we practice medicine or diagnostic for that matter, because today I can sit anywhere and see the slide through my screen and analyze it, and also take second opinions from a colleague sitting in another city or sitting in another part of the world. So that has definitely, I think it's made the turnover time very quick for our patients to get the report. It has also made second opinions very faster. And yeah, I think those are some of the biggest and we can archive these slides and revisit them if we want to use it for education purpose, or if we want to use it for research purpose, or if our patient wants their material. Then all of this is being made possible because of digital pathology.
Okay, so is there any case, right, so where the first time when your manual intervention was something and then it ended up something with the help of a digital tool or anything of that sort?
Not like I said, because AI is not widely accepted. We have not had like a human and AI model.
Competition is not started yet.
But even if, let's say, even if we were to compare, and if I am faster than AI, it will not be because I am faster. It will be because experience brings certain, it makes you observe certain subtleties that our algorithm model cannot. And to kind of get, like I told, complex clinical narrative and human judgment is something that cannot be replaced.
Okay. Many patients, when they are very unsettled and scared, they'll come and first ask you, is everything okay? Is everything okay? That's the first thing that they'll come and ask.
That is true.
How do you actually handle that?
That's a beautiful question, and I really feel like that's my superpower, to be able to talk to patients, because I really enjoy doing that. And so I always tell my patients, especially those who present with lump, because lump can be really scary condition, right? We never really know what it is, and so they'll always be, when I'm doing the procedure, they'll be like, doctor, is it cancer or what is it? So I tell them, let's not worry until we have to. That is my standard reply, because it's not going to help us. And most of the time, 90% of the time, it is benign. That is the most common thing that we see. But being in patient's shoe, we can understand, how
that worry and that fear, that is, and increasing breast cancers all around also is very, very, it's a cause of concern. Also,
and we never want to diagnose something as scary, like it is equally heartbreaking for us. We always double check, triple check before giving a grave diagnosis like that. So I always tell my patient, let's not worry until we have to.
Report sheet, right? So I know there is a test, whatever is done. I know the reference range and I know what range it is also. So in fact, many of the Google doctors also know that if they take this medicine, they're going to be okay. What is it? What do you actually do there? Because why do I really have to go and meet a doctor or anybody else, right? I know it myself. I can go. I know I'll be all right if I'm going to do that. So what is the necessity for that?
So there's really no necessity, but I'll tell you why it is important to meet a doctor. So yes, we do put up ranges, but we are moving more and more towards personalized medicine, right? Because we are now understanding that not everybody is same. So a normal range can differ for you and me. So even though the standard ones are the ones that we put in the lab report, I think it's important for us to correlate that with your family history. Because let's say if your HbA1c is 5.8 and mine is 5.7, but I don't have a family history and you do. So then it becomes important for you to be aware of what all lifestyle changes you have to do. And only an expert can give you that perspective. You can obviously do Google searches, there's no problem, but what I have seen happening is it creates more panic than clarity when you do it yourself.
True. Okay, again. So I've got the report in my hand.
Yeah.
So is it really necessary for me to know all of that? What is there in this?
It's not necessary, but I'll tell you one thing. Our population today is very smart. They're very aware. And the most important thing is they want to know. They want to learn. Most of them are interested in longevity and they want to know how to keep themselves fit. And I'm very proud to belong to this generation of people actually. So if you want to understand what your body is trying to tell you in how your cells are responding to it or how your values are, then you really need to understand your report. And I also understand that my clinician friends, they do not have time to go through each parameters with you, right? Because for them, what's most important is whether it's normal or not and whether you need to be treated or not. They are already dealing with a huge burden. So they would not have time to discuss all these things with. So who do you go to? You go to your pathologist because they are the experts in it and they can really help you decode what your body is trying to tell you.
I mean, is there any means where we can get an appointment with a pathologist and actually talk to them?
Well, it has not become very common in India, but in US and UK, they have started opening up pathology explanation clinics where you can go and meet your pathologist and discuss with them, especially cancer reports or fertility reports. These are very descriptive reports that you cannot really understand each and every word. So in that case, you can definitely go and meet your pathologist. And even in India, if you want to meet, if you want to know who is reporting, behind the microscope, you can always, I'm sure most of the pathologists will be very happy to meet with their patient and, explain to them.
Okay. Yeah. Every day it's always slides and cells, right? So have you ever wanted to meet the human behind the cell?
I have always, because without even meeting my patients, I get to know so much about them, whether it's a male patient, female patient, whether they are a smoker or not, whether they drink alcohol or not, whether, so I get to know so much about them just seeing their slides. And so I'm always very excited to meet my patients. And especially if I've done some procedures with them, I always like to go back and discuss with them, what their report was like. I'm always interested to meet with them. Even though it's a common misconception that pathologists are very antisocial and they don't like to
because
communicate.
Behind the scenes,
they don't like to communicate. But most of the pathologists that I have met in my career, they are all very social and they want to meet their patients.
Oh, amazing. That's news.
Yeah.
Okay, so now that gets to a very interesting question to the youth out there, not only youth, actually the majority of the crowd on the other side. So when a person consumes alcohol, how long will the blood reports stay otherwise?
You mean how long it takes for it to show in the blood?
Yes.
So it will show immediately.
I mean, no. I think I should put it the other way around, right? So how long they shouldn't go for a blood test so that the other parameters fall in place?
At least 72 hours, I would say. Because until then it will show up on your blood test.
Blood test, okay.
Yeah.
It applies for both alcohol and smoking.
Yes,
everything,
definitely,
right? Yeah. How much of damage does it do to the body?
We have a lot of meta-analysis and research available that even one glass of alcohol can affect your mitochondrial health and can cause a lot of oxidative damage. So yeah, there's no amount that is safe.
All right. Okay.
I know it's not what everybody wants to hear, but yeah. But I am a huge advocate of everything in moderation. You know, you should not do too much of anything.
So, I mean, in this current generation, right, smoking and it's become a social thing for everybody, especially even women.
Yes, yes.
So, are there a lot of infertility because of alcohol and tobacco?
Absolutely. I really feel that is one of the very important reason. And another reason is, of course, we are all exposed to a lot of endocrine disruptors, which are all these substances that can affect your hormones, right? Whether it is eating from a plastic container or drinking water from a plastic water bottle, or using perfumes and strong scents, or using skincare that contains a lot of chemicals. So all of these things ultimately contribute to having hormonal imbalances. And
Even a perfume, is it?
yes.
Oh, okay. Interesting.
Yeah.
Okay. But how?
They are all endocrine disruptors, so they mess with your hormones. If used chronically for a long time, once in a while is fine. But if you are, let's say, using a perfume every single day without knowing what the content is of whatever product you are using, then it can definitely imbalance your hormones. So per se, the pathology is imbalancing of the hormone that ultimately leads. There are many causes of infertility, but I think this is one of the very common ones today.
Okay.
And of course, stress adds on to it. Our
Right.
current
Yes,
lifestyle
yes.
is not very grounding. It's not very, we hardly have time to even realize how our breath is, for that
True.
matter, right? Most of the time you'll realize you're not breathing at all. That's what I've seen with a lot of young females that are struggling with these things. But yeah.
Junk food and youngsters are something inseparable now. So, people, they actually don't bother about eating outside or how often they should eat outside. So, does that also have an effect to the cell level?
Definitely. So, and I think even Ayurveda agrees with this. If you're not eating fresh food, if you're not eating a food that contains a lot of pranic energy, then that definitely affects you. But I feel like if you're following 80-20 rule in general, like eating 80% of the time, eating good food, nutritious food, and eating out 20% of the time, then it is not so bad. But yes, at cell level, if you're eating a lot of fried food, lot of processed food, then it does lead to a lot of oxidative damage in the cell, and we can actually see that under the microscope.
Okay.
The ability of your immune function to respond reduces. The ability of your cell to repair the damage reduces if you are consistently having a diet that's not good for you. So all of these changes can actually be seen under the microscope.
So, can your microscope also see the sleep imbalance? And because a lot of people, they have rotational shifts, they don't maintain a biological clock, isn't it?
Absolutely,
So, does that also affect at the cell level?
It does affect, but we cannot necessarily see a change and pinpoint that it's because of bad lifestyle or because of like sleep imbalance, because all of these things ultimately leads to the cells being damaged because of the oxidative stress. So yeah, pinpointing the cause can be difficult, but damage, yes, we can definitely see it. Yeah.
So, once cells are damaged, I don't know, it's a very, very layman question, right? So, once the cells are damaged, can you actually get them back to the normalcy or a healthy cell group?
Right, and that's a very good question. But our bodies are very smart. Our body itself has a repair mechanism in place. So unless you have exploited it a lot to the maximum, it always tries to repair. So leaving smoking, even 30 minutes later, you can start to see the cells going back to their original, state. So body has a very good repair mechanism in place. The only thing is you should not exploit it too much.
Anything within the limits is okay.
Yes, definitely.
Okay. So, moving on to a little lighter question, right? Is there any slide that you've seen and you've just laughed out loud?
Slide, not so much, but we do tend to have, so whenever the samples are collected, they have to be transported from one place to another, right? And so during this transportation, sometimes something that is not supposed to come ends up in our table. So I remember this incident very well when, all of the samples were being carried to, and I think someone left their tiffin box into the tray transport basket, and when we saw this sample we were like, okay, nothing is written, there's no identity, how are we going to trace the patient? And everybody panicked, and then it turned out to be a coconut chutney. So we had a really good laugh.
Coconut chutney dissection would have happened. It's a very weird question. You do diagnostics only for humans?
Yes, we do only for humans, but there are veterinary pathologists also. Yes.
Okay. So do you actually enjoy watching medical dramas, even if all pathology has gone wrong in that?
I do. I love watching medical dramas, and pathology is very misrepresented in all the medical dramas. It's also very underrepresented. So if I'm seeing any pathology related content, I'm like really happy, because then at least people know that, there are these doctors who exist. But yeah, it's either over dramatized or they get it all wrong, but I'm here for all the drama.
Okay. Have you named your lab equipment?
I probably have not, but we look very fondly towards all our analyzers because they really help us a lot. So before these analyzers came into pictures, pathologists would sit for hours and count each and every cells. Can you imagine what that world would have been like?
I know.
Your WBC is, let's say, 6,000, 7,000. We would sit and read all of that 7,000, and it used to be done manually.
My God.
So we are very grateful for our analyzers. But I might not have named them, but I've definitely spoken to my microscope, during long diagnostic hunts, like, let's do this, or, let's find out.
So if you have to really name them, what would it be then?
I don't know. There's this doctor on Instagram who calls the microscope Tabitha. So I really like that name. Like, this is my Tabitha.
Okay. And so does any pathologist need a doctor at all?
We do. When we are sick, we do need doctors, just like everybody else. But the difference is that we can definitely advocate for ourselves that way.
Right. So, I mean, without any doctor's advice, have you, taken any tests thinking that this could be the reason and all of that? Have you done anything by yourself?
Oh, I think all of the doctors do. We, like I said, we tend to be good doctors but not good patients. So we would immediately imagine the worst, like, this has happened, okay. And then we'll go on to do all the tests that is possible. So yeah, I have been there.
So when the COVID actually peaked, how many times did you check for yourself?
Those times I honestly didn't check much because I was so tired of seeing the same thing every single day. I'm like, even if I do end up getting it, I would like to believe that I can fight it off and not every single time. So yeah, I did not test that much.
Okay.
I would bring that to home to my husband, so I really didn't want to think about it.
How scared was your family when you were in the lab during that time?
So my husband was there with me at the time, and he was not as much scared as I was to bring something to him, because at the time we really didn't know how anybody's immune system is going to respond, right? It was not really about the age or about the fact that you were young and all of that. Yeah. So I was, I think, more scared for my family, not for myself.
Have you ever diagnosed anything very rare that has made you just happy dance, even if it is just in your head?
No, I would actually do the happy dance. But so I still remember one of my professors used to tell, if you diagnose something rare, then you are rarely going to be correct. So we always try not to give any rare diagnosis, because then we know we probably might not be correct. But I feel like every diagnosis that has a treatable outcome makes me do the happy dance.
Okay.
So,
Nice.
yeah.
So a pathologist deals life and death at a cell level. That is a minute thing, right? How does it change your perspective about a human body?
That's a very good question, actually. So, when I was studying to be a pathologist, and when we are spending like really long time in the lab just dealing with the samples and not meeting anybody necessarily, especially after the night duties and all, if I would meet any new person, I would immediately break them down into cells. And I'm like, okay. I would be like, okay, this might be going on underneath, and maybe that's why this is a symptom. So I would immediately start observing these very minute little things. And my husband used to make fun of me. He's like, you're not like real life House, okay? Don't try to do that with everybody.
Report that has actually broken you down.
Not just one. I am always very heartbroken after a pediatric tumor is diagnosed, because I don't really, I cannot justify in any way why a small kid would be suffering. So I always try to double, triple check, take it to my seniors, take it to my professors, and then if that turns out to be the outcome, then I think it really gets me down for weeks, and I feel like I don't want to do this anymore.
So, as we believe that it is a silent engine, pathology is a silent engine. What if it fails?
I think it can bring an entire hospital to a standstill, because like I said, modern medicine, almost 80% of the clinical decision depends on our reports or what we give. Right. So if a lab breaks down or if a machine breaks down, then it can really delay the diagnosis, but also the treatment and everything else.
So has there been any incident where the machine has actually not done its work properly and you had to give,
So we deal with such issues every single day, actually. That's why we have certain quality controls in place. So before running the patient sample, we'll try to run those QCs before, starting our day. And so every single day we try our best for machines to not break down and do their jobs correctly. But it does happen. And in those times, I believe the communication is your biggest, ally, because you need to communicate the same to the other doctors who are treating these patients and who are facing these patients. But we also need to communicate the same to our patients also. And that can be a really hard job. So we try our best not to break down the laboratory.
So, is it true that many doctors, they actually give the number of tests just because they have to get these tests done and they have to increase the revenue for the hospital? Is it actually true?
I'm sure that happens in a lot of places. But like I also told you that we are practicing very evidence-based medicine today. So sometimes you really require that many tests to kind of prove to our patients that, this is what it is and this is what you need. So yeah, I'm sure that happens.
I mean, have you ever thought that the entire medical, the medicine, the English medicine will actually come to a standstill if pathology does not exist anymore?
I would like to believe that as a pathologist.
Okay.
But, I think even since the times unknown, they were not called pathologists, but diagnosticians were always there, and they were always trying to find what is happening and, what's happening beneath the cells. Like,
Right.
yeah.
What is your career path as a pathologist?
Oh yeah, I think this is something that a lot of medical students are also always interested in knowing. So after you finish your MD, you can obviously choose to have your own practice and work as a diagnostician, open your own lab, and work with other doctors there. That's one way to go about it. You can be in a medical college setup, especially if you like teaching medical students, because pathology is a very academic branch. So like I told you, we're not specializing in just one organ or just one
Right.
system. It's not like we're just dealing with bones or just dealing with female reproductive thing. So we have to read a lot. We have to study everything about everything. One day we are seeing a brain tissue under microscope. The next minute it is, a TB or a tuberculosis. And so one minute we are seeing autoimmune, another minute it is cancer. So there's a lot to study. And people who are interested in research and teaching can choose to be in medical college. Another way to go about is, especially today, a lot of people are getting involved with training the system for AI models. So they're doing data annotations and getting involved with company working in AI. And yeah, or you can choose to do super specialization or fellowships in, like, let's say, neuropathology or renal pathology. So you can just be diagnosing a very specific set of diseases.
Does it give as much as money as the other regular doctors get?
To be honest, diagnostics are a little less paid branch as compared to other branches of medicine. But that's also changing now. There is a shift where people are genuinely interested in diagnostics, and because, like I told you, people are getting more aware also.
Right.
And there's this trend of getting your health checkups done, routine tests done. So I think it's coming to the limelight more and more.
Doctors and work-life balance is always in the opposite ends, right?
Yeah.
But pathology being a day job, so how has it actually helped in your work-life balance?
So I think at the time it was not a very conscious decision when I chose diagnostics, and we had to do night duties even. So there are certain emergencies also that pathologists deal with that a lot of people don't know about. But work-life balance is great. In fact, pathologists are some of the happiest doctors that you will meet. And the reason I feel is because of the work-life balance. We have the flexibility to choose our own work timings. And with the digital pathology, I think working from home will be possible in the near future. So even though it was not a conscious decision, I think this is something that I really needed, because I'm a very type A personality, and so having the work-life balance really helped in that aspect.
Awesome, awesome. So you had mentioned about emergencies, right?
Yes, yes.
So how does pathologists deal with emergencies?
So there's something called as frozen section. Which is when the patient is on the operation theatre table, and a surgeon is not sure of the nature of the disease and they want to immediately know the diagnosis. They would take a little bit of the tissue when the patient is on the table and send it to us to the laboratory, and we have to give the report in a certain time frame because the patient is open on the table, so we have to give it as fast as possible. So that's one of the emergency that we deal with. Because we have to tell surgeon whether the surgery was complete or not, whether what they are dealing with is benign or malignant. And so traditionally what we do is we put the tissue in the wax and harden it, but during frozen sections we freeze the tissue. So it becomes easier to cut it and give the diagnosis. Another emergency is always blood transfusion related emergencies, and sometimes if we come across leukemia, which is blood cancer, that becomes an emergency because we need to immediately inform about it. And then sometimes the platelets, when the platelets are very low, we have to do the manual count. We cannot trust the machine. So those are some of the emergencies that can present at the night time, especially if you're working in a hospital or a medical college setup. So yeah.
Okay. Breast cancer being on the high rise right now. So how benign and malignant are two things that generally happens,
Yes.
occurs, right? So if it is painful, is it considered to be non-malignant?
Generally, yes. So most of the malignant conditions would present as a painless lump. And if it is painful, then that generally tends to be benign. Exceptions are there, but majority of them, this is true.
Okay. So how soon should one come for a examination when there is a lump?
So ideally, if you ask me, immediately as soon as you find out, it's always better to know. Like you have to be aware and know what it is. It's always better to know. So as soon as you find out, you should get it checked.
It's just not only breast, right? Any, I mean,
Any
see,
lump,
if it's
yeah.
any lump, it's always better to do it.
It's always better
immediately.
to check. Yeah.
Okay. So lumps so as just putting it into a small context. So lumps, even if it can be malignant or non-malignant. When I say malignancy, it is cancerous, right?
Yes.
So it can be there or it cannot be there. If it is painful, majority of the time it is not considered to be cancerous.
Yes, that's true. Yes.
Okay. As a person who's just doing a basic CBC, complete blood count test, right? Can it actually tell that there is a problem in your body? So what means what?
Yes, definitely. CBC, even though it's a very simple test, it's like a mirror for us because it can mirror your general well-being. So there are various parameters. For example, if your WBC on the higher side, then we would consider more of an infection to be the cause. If your hemoglobin is low, if your RBC counts are low, then we would think that you are probably dealing with anemia. If your platelets are on the lower side, if your lymphocytes are increased, then we know we are dealing with viral infections. So CBC per se can give us a lot of information, about your general well-being.
So even if it's going to be a bigger issue at the later stage, your CBC can be an underlying proof of evidence that you might have something else.
Absolutely,
also, right?
absolutely. Yeah.
It is not required to be only infections or any bacterial infections or viral infections. It can be anything.
It can be anything, yes.
Right.
Yes,
So in case if I'm going to do a CBC, can I actually know that I have a kidney problem?
no.
Okay. Are there anything that
Yeah,
CBC
you have
will
to
not-
do renal function test. But if the kidney problem has been chronic, then eventually it will go on to affect your hemoglobin also.
Oh, in
So-
this case, it's the other way around.
It's the other way around, yes.
Okay.
But if we are seeing certain changes, if we are not able to pinpoint the cause of your anemia, for example, then we'll go on to further do your renal function test and your iron profile or, any other nutritional deficiency if you are thinking.
So somewhere your blood will show up.
Everything is correlated and
yeah.
interdependent. Yeah.
Okay. So a simple CBC can
It tells us a
open up
lot. It tells us a lot, yeah.
Okay. So, to wrap up that wonderful conversation, right, that informative conversation, so if you have to give a general advice to the public, what should they look out when they are coming for a test?
One of the important thing if you're coming down for a blood test is to remember that you have to fast for 12 hours. A lot of people don't take that seriously. I think a test like your lipid profile or any other hormonal profile can get affected with the recent ingestion of food. So make sure that you have 12 hours of fasting. Make sure that you ask your doctors how painful it's going to be. Most of the people are apprehensive about the test. Make sure that you understand and discuss with your doctor what those report means, and you can always choose to come back to your pathologist and discuss it with them. I'm sure most of them will be happy to do it. And remember that doing the blood test just one time is not enough. You have to keep checking. You have to do yearly screening. That is very important, especially in today's day and age. I think a lot of us take it for granted and not do our yearly examination, whether it's because of the fear of finding out something or because of the apprehension. But I think it's always better to know, because knowing empowers you, knowing gives you that advantage of getting an early diagnosis, and knowing helps you advocate for yourself with your doctors at least. So yeah, I think that's what I would want to tell
That's
everyone.
amazing. That was an amazing session, Dr. Supriya. Thank you so much. We really didn't know a lot of information and what actually a pathologist can do, right?
Yeah.
So, pathologists are the basic, probably stepping stone to a better life, is what I can say. So,
I am so glad to hear you say that, because then I could communicate what I wanted to communicate across.
Absolutely. Thank you so
Yeah.
much for your time. I think it would have definitely be a very informative session for our audience too.
Thank you so much for having me.
Our pleasure. Thank you.
Thank you.